this webinar by introducing, thank you, by introducing the learning platform to those who have not attended the previous session. The regional learning platform on care reform has been established by UNICEF in collaboration with Changing the Way We Care. And the purpose of this platform is to extend learning on care across the Eastern and Southern Africa region. The platform includes a series of virtual study tours, which are designed to let those who cannot travel due to COVID-19 and other constraints still gain an understanding of care reform in other contexts. Today's virtual study tour on care reform will be learning from Zambia and Malawi. This platform is open to all the 21 country offices, UNICEF country offices, including the government and other partners working in the area of care reform. I'd like to also give a very warm welcome to all the government representatives who are with us today, and to the UNICEF child protection colleagues and other various CSO partners working in the area of care reform who have managed to join us. So let me now take you through the format of this webinar. We sent out the invitation with a series of documents and videos for you to read and watch. So I do hope that most of you, dear participants, managed to already review the documents and the recorded interview that was sent with the invitation of this webinar, as this webinar is primarily focused, is giving a primary chance for you to ask questions to Malawi and Zambia. We will begin by asking a few questions to the panelists, and then hand over to participants to ask some additional questions. So please type any questions you may have in the chat box, and we'll ensure to respond to them. Before we start, I also want to thank Emily Dilla, who is the consultant hired from Child Frontiers, and she's the one that is supporting the organization of this platform. So thank you very much, Emily, for this webinar. So dear participants, please fasten your seatbelt as we virtually travel to Malawi and Zambia to meet with the esteemed panelists and learn more on their work on care reform. So I'd like to start by asking the panelists from Zambia to briefly introduce yourself by letting us know your name, your job title, and organization, and briefly explain your role in care reform. So let me start off with Clement of Zambia. Here, Mr. Chibuta, please switch on your video and introduce yourself.
Sorry to just interrupt quickly, Mona. Some of the participants are saying they're having a bit of trouble hearing you. There's a bit of an echo on your line. So I don't know if you have another microphone that you could use. And maybe while you're trying to sort that out, Mona, I can just ask the panelists from Zambia to please go ahead and introduce yourselves. And just a reminder to the people listening in, if you could just put your microphones on mute unless you're speaking. Clement, why don't you go ahead and introduce yourself?
Right. Good morning. Good morning in Zambia. So good morning to you. My name is Clement Chibuta from Ministry of Community Development and Social Services. I'm a senior social welfare officer in the ministry, Department of Social Welfare. My role there is basically coordinate issues of alternative care, ranging from ensuring that children, placed formally in institutional care, but much more to champion the agenda of government to ensure that children grow up in families. So the administration of children in formal care, and also ensuring that children grow up in families, and ensuring that institutional care is a measure of last resort. So this is a desk that I hold in the whole context of care reform. Thank you so much.
Thanks so much, Clement. Mona, we're also hearing a bit of background noise from you as well. So if you could maybe just put yourself on mute when you're not speaking as well. Sorry technological issues. Do you want to try speaking again, Mona, and see if we've resolved that problem with your microphone? Oh, just Mona's on mute. Perhaps while Mona's trying to resolve that issue.
Can you hear me better now?
A little bit better.
Oh dear.
I know. Don't worry. I think
with the introductions, yeah.
I'll go through the introductions and then you can see if you can resolve it. And if not, I can always step in. Mwanza, did you want to introduce yourself? Mwanza?
Good morning, everyone.
Go ahead.
Good morning, Emily. Good morning, everyone. My name's Mwanza Chilufya Malupande. I am a Child Protection Officer in UNICEF Country Office, Zambia. My portfolio is providing technical support to the government of Zambia in the area of alternative care system strengthening within the broad child and family welfare system strengthening support that UNICEF is supporting government on.
Thanks.
Over.
Thanks so much. And last but not least, Jeremiah, did you want to introduce yourself from Zambia, please? If you're still with us. Jeremiah, did you just want to briefly introduce yourself? Okay, perhaps Jeremiah is having a few technical issues, so maybe we'll move on to our friend. Oh, hi, Jeremiah, please go ahead.
Okay. All right, so I'm Jeremiah Banda, Programs Director for the Zambia Association of Sisterhoods. We are also working to build capacity of women congregations in Zambia around the national child care reforms, and also to see into it that we together discern and reflect on the changing the model of care from institutional care to family-based care. So we are really working as a team with the other partners that are also championing the same core in Zambia.
Excellent, thanks Jeremiah, thanks for joining us. Maybe we'll move over to Malawi now. Enoch, did you want to start off by introducing yourself? Enoch, are you able to introduce yourself? Otherwise, we'll just move on quickly to Trofina.
Hello.
Hi, Enoch. There you are. Great. We can see you perfectly.
Yeah. Yes, I tapped on the mic and I think it did not turn on.
Oh, that happens. Please go ahead and introduce yourself.
Thank you. As Emily said, I'm Enoch Bonongwe. I work as Deputy Director of Social Welfare. My portfolio deals with family and child welfare, and this is the division that now deals with the whole areas around custody and guardianship of children, alternative care of children, and so on and so forth. Before I was promoted to Deputy Director, I was directly involved in the reintegration process, the revolution around care reform in Malawi, and I have had experience from that time on up to now. I look forward to learning more from our counterparts and also from those that are listening in, and they will be sharing their experiences and also asking questions. Thank you.
Thanks so much. That's fantastic. Trofina, Kimbani, do you want to introduce yourself? If you're able to.
Yes, Emily. Thank you so much. My name is Trofina Limbani, and I'm the Principal Social Welfare Officer in the Department of Social Welfare. My portfolio is I'm coordinating family and child welfare services, where alternative care falls into. And I'm glad also to report that before I joined ministry, right now I'm at the ministry headquarters. I was at the district, where I was also involved in the actual implementation of our reintegration program in one of the 4 piloted districts, that was Blantyre. So I have a vast experience in terms of the process that we've gone through in terms of reintegration in Malawi. I'm yet to learn a lot. Thank you so much.
That's fantastic. It's so great that both you and Enoch have that experience at multiple levels that you bring. That's fantastic. And Miriam, last of all, from UNICEF Malawi, would you like to introduce yourself?
Yes, please. Good morning, everyone. I'm Miriam Kalua. I'm currently working with UNICEF as the Protection Cluster Coordinator, coordinating all humanitarian situations related to protection, including COVID-19 on children and other vulnerable populations. But before then, for 15 years, I've been involved in the care reform agenda, coordinating the response at national level and the district level, working with the government to ensure that we have the system in place, we have the tools, and then we have programs running. Thank you very much. And then I look also forward to a fruitful discussion. Thank you.
Thanks so much. We have such strong panels from both countries. Mona, are you able to speak now? Is your microphone working?
I hope you can hear me much better now. Can you confirm?
That's a big improvement. So I'll hand back over to you. Thank you, Mona, for sorting that out.
Thank you, Emily, for introducing this expert panelists that we have. And I really look forward to learning more from all the experts in this panel. So let us now go straight into the questions. We'll start with question 1 that will go to the panelists from Malawi and Zambia. And I would like to start off with Mr. Enoch Bonongwe of Malawi. So here is the question. In both Malawi and Zambia, and also for the Zambia, you have Mansa Chilufya Malupande responding. So here's the question to Mr. Bonongwe and Mansa. In both Malawi and Zambia, strengthening the workforce has been a key part of care reform efforts. Can you explain why you decided to focus on this area and what you have done? Starting with you, Mr. Bonongwe.
Thank you. I think we'll start from Malawi. We, as a country, we saw that after learning from those that did it before, we learned that we really can't use just the same workforce we had to go into care reforms. We needed to kind of beef up our staff, as well as bring in skills for us to effectively make assessments and go into this field, which to all of us was new. Now, looking at the current workforce and the task ahead and the speciality of the area, we thought there was need really to strengthen the workforce. So what we did from the beginning was to sort of identify 40 social workers that would do work in the districts and in trying to do the assessments and all the processes of reintegration. But we also saw the need that the 40, we were capacitating them, but we needed to have in the 4 districts, we employed 16 social workers to work specifically on day-to-day basis on care reforms. And what we did was to take the 16 to lead the process and the 40 to do the actual work. So each district had a group of social workers. Though the 16 would lead, guided by the district social welfare, and the other officers would do the rest of the things. We had trained them in a series of workshops. What we did was to engage a consulting firm that had done reintegration in Rwanda, HHC, and it helped us to model out how we are going to do our work in Malawi, and it was responsible for capacity building. And I think with this workforce, we really achieved a lot in terms of having the systems in place, having the tools in place, and assessing the initial number of children, reintegrating the children, following them up. And at the end of the day, we also had to do a feasibility study to see what works and what does not work in Malawi. As we speak, we have the reintegration model for Malawi. Of anyone who wants to go into the field, we have lessons of what works and what does not work in terms of reintegration. Thank you.
Thank you very much, Mr. Bonongo. It's very impressive to see how Malawi decided to prioritize on the workforce, build capacity, and having a standardized model that is used for the reintegration of children. Let us now move to Mwansa Chilusia Malupande. Over to you. Let us know the Zambia experience in strengthening the workforce and why you decided to do that. Over to you, Mwansa.
Thank you, Mona. Thank you very much. So from Zambia, unlike Malawi, government and partners were cognizant of the fact that the opportunity to employ new social welfare officers or social workers was afar off. So we decided to work with what we had and what we have currently. And just to mention that the idea of continuing to lobby for more officers still is on the table for us. But in the area of strengthening the social welfare workforce, what informed our efforts was basically lessons from Rwanda. When we went to Rwanda for an exchange visit, we drew lessons from there. But also at the same time, UNICEF was supporting the government of Zambia to undertake a nationwide study on the status of care in childcare facilities. And what that study brought out was the fact that there was gaps in competencies and skills, both at district social welfare office level, as well as facility level, particularly in the area of case management. So that was a springboard for us, and that was a niche that we decided to pick up on to see how then do we strengthen the capacity of staff, both at government staff and those working in childcare facilities, the social workers in childcare facilities. So as a building block, we decided to support government to develop guidelines, alternative care and reintegration guidelines, as well as case management tools and standard operating procedures, basically to help model a standard way of providing alternative care services, as well as the reintegration process. So those tools provide a standard package. Following that development of the tools and the guidelines was a series of orientation trainings that were held at national and provincial levels to train all childcare facility social welfare officers, social workers, as well as district social welfare officers in the 52 districts that have childcare facilities. And broadly, that orientation was scaled up to districts that also do not have childcare facilities, recognizing that officers might be transferred to other districts. So just building the capacity of district social welfare officers countrywide. But we recognize that, that the orientation was not providing the foundation that we needed the officers to be grounded upon. So UNICEF supported government to enter into a partnership, together working closely with a group of NGOs in an initiative we call Children and Families, to partner with the University of Zambia, as well as the Mulungushi University, to develop a set of modules in alternative care processes, as well as case management processes. So this way, the training was standardized, and whoever wishes to venture in providing care and protection services to children would be recommended to undertake that training. So the training was developed and rolled out, and is still being implemented right now. And the training has both the theory and the practical elements. So when the trainers get when the officers get trained, at the end of the training, they are assigned cases at their offices that they are monitored and mentored on to strengthen their skills and capacities. And just to wind up, there's also the work around licensing and certifying the social workers. So we've supported the ministry working with the Social Workers Association of Zambia to develop a competency framework that spells out the minimum competencies that as professional social worker, as well as a parasocial worker, should have to be able to work with children or provide alternative care services to children. Thank you, Mona.
Thank you so much, Mwansa. Also very impressive to hear the various efforts Zambia is putting in place to ensure that the care reform agenda is advanced in a professional way. And one thing that is coming out from both the two speakers from Malawi and now Zambia is that there's a need to have standardization of training modules, standard operating procedures, so that if we, at a country level, you have standardized methods. And also the point you made about licensing and certification of the social welfare workforce, also something very important to take into consideration as we professionalize this cadre of very important workers from government that are needed to advance the care reform agenda. So thank you very much. Let us now move to question number 2, which will go to, starting off with Malawi, Trofina Limbani, and then to the government of Zambia, Clement Chibuta. So here's the question. In both Malawi and Zambia, a lot of effort has gone into ensuring the safe and effective reintegration of children from residential care back into communities. What lessons have you learned about how to reintegrate children? So let us start with you, Trofina. Over to you. Experiences from Malawi.
Thank you, Mona. As for Malawi, there have been so many lessons that have been learned since we started the reintegration program. For Malawi, we started with 4 districts where we were trying to pilot to see how best this program will work. So one of the key lessons that we've learned is the need to have dedicated staff. As we all know that reintegration is a process that takes some time. So you need staff that is dedicated to see through the whole process from where you start creating awareness, child assessment, the tracing of family, and all that up to the end when you reintegrate a child. So that's why maybe Malawi, it was an advantage that we had 40 officers to do this, and it really helped because the focus was on this program during the time we were starting. The second issue that we also learned is the issue of financing. Reintegration requires financial resources. From all the stages of reintegration, you note that you need to engage children, to engage the families, the issue of tracing. All that requires us to have adequate finance. And that can also be linked to another lesson that we learned, the post-placement support. Yeah, there were some children that needed some kind of support to ensure that they do settle down well and cope in the new environment at home. So we needed to provide some kind of support in terms of education, school fees, school materials. So financing is very, very important if we are to succeed in reintegration. And the other one is issues of leadership and technical support. We were working with a number of stakeholders. One key player was the child care institution managers, the caregivers. So we needed to provide that technical support for them to understand the concept of reintegration, the importance of family-based care. So as a ministry, we were there to provide that. As earlier on said by Mr. Bonongwe, to say we had to build capacity. So it's issues too of providing technical support. And another lesson that we also learned was a need to conduct regular follow-ups. Yeah, when a child has been finally integrated, we needed to make a number of follow-ups to ensure that the child is not vulnerable again, because in some other situation you would expect that. So follow-up would help to see that the child is settling down, is going to school, has enough adequate nutritious food and all that. And also participation of all the key players, right from the communities. We needed participation of the community leaders, participation of the CCI, because we needed a buy-in from the CCI. So their participation was also very important, because in some instances there was some kind of resistance, but with their participation, it really helped so that they should be brought on board. These are some of the key lessons that we learned, and we are still learning, because the program is still on. Thank you very much, Mona. Over.
Thank you, Trofina Limbani, for those excellent insights of some of the lessons learned. And you've really highlighted, one key point I picked up is the area of financing, ensuring that, the financial resources are available to support the whole process, not just the reintegration of children back to a family-based environment, but also the post-placement follow-up. So thank you for that. Let us now hear from Clement Chibuta. Over to you to give us experiences from Zambia, the lessons learned.
Thank you so much, Mona. And yeah, so from Zambia, we pretty much have a similar story with Malawi, though I think I need to point out certain key.
Ask that we mute our microphones, please, so that we hear from Clement. Dear participants, please mute your microphones. We are having some interruptions. Thank you. Over to you, Clement.
Thank you so much, Mona. So I was saying that to begin with, we could look at the aspect of leadership in the whole context of reintegration. So the government of Zambia, through the Department of Social Welfare, has been providing oversight and leadership in ensuring that the process of reintegration is actually efficient, and national and the district level, the government is there to provide the leadership. You may be interested to know that Zambia is piloting, what we are calling Children in Families project. So there's one called Children in Families Plus, and the other one, Children in Families Ongoing. But this point just goes to indicate how we value the aspect of a multi-sectoral approach towards reintegration. So we have a number of partners that come on board to ensure that the reintegration process is a success. For example, we have Save the Children, CMMB, that's Catholic Mission Medical Board, the Catholic Relief Services, Alliance for Children Everywhere, and of course, UNICEF. So you will note that for us, we want to emphasize the aspect of information. At entry level, once you get the adequate information when a child is entering formal care or into a child care facility, that provides a very good platform to ensure that you get to know what this point, and ensure that you have all the necessary records about the child and the family, how you can engage the family to get the reasons for separation, and to do an adequate care plan on the child and the family to ascertain their willingness to take back the child, and who else is willing to take care of the child, not to step in case the family cannot take care of this child. So one key lesson there also is the aspect of having a complete set of information with you, to help you to be able to decide to take back this child back into the family. Like Malawi, also we can talk about the issue of a reintegration package. I know they mentioned the issues of finance there. So working together with the other partners, we as government have leveraged on maybe the capacity of other partners to be able to provide a reintegration package, especially to families that where we're taking back these children to, and this is case by case, assessing the needs of the family and then providing a reintegration package, which could be in form of money and also maybe some other materials to help them take care of these children that come from institutional care. Follow-ups, I think, are very, very key in ensuring a successful reintegration. So like I did mention, some of the partners that we work with are directly tasked with the following up of cases that have been initiated for reintegration of have actually been reunified with their families. So they do make follow-up, but remember I did mention that all this has oversight from the government. So government of providing oversight from national to district level. I wanted also to I think mention one thing about the involvement of community members. We have a structure called the CWAC members. So these are community welfare assistant committees, and this is a community structure that is tasked with case management at community level. So we begin from there, and they are there to offer intensive family support. They are there to identify even other vulnerabilities that the family might, be encountering, even as we make decision to reintegrate the family. So the involvement of community structures, community level or village level, if you like, is one key lesson that we have learned. So in summary, we would say that you see, once there is a clear assessment of the family from the onset, once we do an appropriate, family engagement, and the family is supported, the likelihood of a successful integration is actually very high. So in a nutshell, that is what I would say are the key lessons from the Zambian point of view. Thank you, Mona.
Thank you so much, Clement, for sharing those lessons. And really important, you highlighted the importance of having government ownership and leadership in advancing the care reform agenda. And also you've touched upon the multi-sectoral aspect as an important mechanism to deliver holistic, reintegration package, and how best you're leveraging the resources.
Battery 100%. 9924001.
And how you're leveraging resources with partners when it comes to provision of the reintegration package. Also, another important highlight there I want to make is on the complementary approach of how you're working with the community volunteers to do the day-to-day follow-up of these children who are placed in families, and how the community volunteers are linked with the professional, social service workforce. Thank you for that. Let us now move to question number 3. This question again is for Malawi and Zambia, and we want to have Miriam Kalua of UNICEF Malawi to respond. And for you, for Zambia, we'll have Mwansa Chilufya Malukande. So question number 3. We know that in Malawi, Zambia, the region, and across and beyond, COVID-19 pandemic has hit vulnerable children and families very hard. What effect has this pandemic had on children's care, and how have you responded? So let's start with Miriam. Over to you. Please mute your microphone. We have Busanda's iPhone. Please mute your microphone so that we can hear from Miriam to let us know the effects of the COVID-19 pandemic has had on children's care, and how have Malawi been able to respond to that. Over to you, Miriam.
Yeah, thank you. I'll speak broadly on childcare, and then I'll narrow down a bit to children in institutional care. We've noted, I think, as we've all noted, COVID has had economic impacts on the well-being of nations, and Malawi has not been spared, as well as childcare institutions. For Malawi, for the first time, we noted, even in urban areas, the government introducing an urban cash transfer program, having noted how it impacted negatively on the livelihood of households, and then even increasing vulnerability in terms of providing quality care for children. So we look at quality care in terms of even providing children with good and nutritious food, quality education, even support which may be required physically and emotionally to children. We also noted a little bit on reports increasing through case management reports on increasing violence against children. For Malawi, we were very hit for the first time due to COVID pandemic. When we had lockdown, children could not go to school for 3 months or so. It was the first year that in the country we recorded about 13,000 child marriages within a space of a year, and 40,000 adolescent girls falling pregnant. So childcare institutions were also not spared. This was also one of the impacts. And then we also noticed the quality of care, even institutional care for the children that remained. After the lockdown measures were announced, the government had to quickly direct closure of institutions, or to ensure that those that were overcongested, they do decongest, to ensure that they also adhere to COVID-19 prevention measures. So about some 25 institutions had to quickly reintegrate children without conducting proper assessments or the case management process. And that involved around 97 children that quickly went back to their homes without assessments. And then here we are in a situation where these are also some of them are vulnerable households. And then the psychological issues that children faced as they joined the new families without being prepared. It was also noted they could not go to school as well. So we had a number of issues. And then secondly, for children with disabilities in childcare institutions, they couldn't quickly adapt to the new measures. For example, they were complaining they couldn't get instructions from teachers who were putting on masks, even if they were face shields, because they couldn't comprehend. So I think we had a number of issues around promoting quality learning for children. We didn't have alternative measures in place to promote online learning. It started in the course of time. So children were just there. We had this impact of pregnancy and children getting married. We've tried as much as possible to recover like 50% of those that got married, and we're still in the process of saving some, but it's a long way to go to reverse the negative impacts within a day. And then secondly, we also noted for children that were in childcare institutions, in Malawi, mostly they do rely on donors from the Western countries, which were also had this hit by COVID-19. So we found that some of the institutions had to close down, and some completely had to change. I think they had to provide alternative means of providing care to children. So issues of feeding, issues of diverting, for example, support that was meant for clothes to be used for procurement of food items. So mostly reduced, and we even noted from some childcare institutions reporting a 75% reduction in funding. So we noticed that even the quality of care for children, should it be education, should have gone down, much as we've not conducted a major study or a national study on the impacts. So thirdly, we also noted that due to lockdown, the closure of institutions, I think I had already mentioned about that, the closure of institutions impacting negatively on children, and then without even follow-ups on them. I think that's also one of the challenges that we face. And then in terms of what we did, number one, UNICEF also worked with the government to engage Save the Children, to support the government to quickly follow up on the children that were hurriedly reintegrated, about the 97. So they were followed up in collaboration with Save the Children to ensure that they are reassessed and then their needs are identified and are supported accordingly. And then secondly, routine monitoring, financial support was also provided to routine monitoring of all the reintegrated children. So this one meant the current ones and those that were reintegrated before because of reduced, increased vulnerability at household level. So they were also monitored to ensure their well-being is being sustained. And then secondly, when the lockdown measures were announced, we noted those that were hurriedly reintegrated had to be re-enrolled in school. So there was a follow-up and engagements with the education sector to ensure that they were re-enrolled in school. Fortunately, all were re-enrolled in school apart from 3 that fell pregnant, 3 girls. But engagements were also, the government had passed a directive that even girls that had fallen pregnant should be allowed to continue with education. So that was also one of the measures that mitigated that. And then thirdly, UNICEF also supported the government through the Malawi Human Rights Commission to monitor all the institutions and then to be able to assess the situation of children institutional care. So all the 169 institutions that were there in 2017 were monitored, and from that quickly we noticed that some had closed down. There are now about 124 institutions, and the number of children in institutional care had also reduced from about 10,000 to half by now. So we noticed also the number of children hurriedly going back because of COVID-19 as one of the contributing factors, and then routine reintegration of children. Through that study, it was also noted that some cases of violence, of course, were still continuing in institutions, and a few were recorded during the COVID-19 period. Some institutions, about 90%, couldn't adhere to COVID-19 prevention measures. About 10% were still struggling to provide hand washing facilities, the soaps and the like. So we also find that somehow levels of adherence, much as the knowledge levels were quite high, but adherence to COVID-19 to ensure the safety of children was also an issue. So that study helped a lot to establish the current situation of children, even during the COVID-19 period. Let me stop there briefly. Thank you.
Thank you. Thank you very much, Miriam Kalua, for highlighting those very sobering challenges and issues that children faced during the onset of the pandemic, issues such as teen pregnancies, child marriage, school dropouts, and many others that you mentioned. I'm very happy to see how UNICEF in Malawi worked with government to advance the reassessment of these children that were quickly reintegrated without due process being followed, and ensuring that proper care is provided. And also another area that you touched upon, Miriam, is looking at how to use research to understand the current situation in the light of COVID-19 and how you can inform programming to ensure that children are cared for properly. So let us now move to Mwansa of Zambia to also give us some lessons learned from Zambia. Over to you, Mwansa. Mansa, please, if you're speaking, unmute your microphone. Thank you.
Hi, Mona. Thank you
Hello,
very
we can
much.
see you. Thank you.
Okay, thank you. So similarly, I think that the response and the challenges, as Malawi has highlighted, are similar to what we experienced as well in Zambia. And just to highlight or to echo is the fact that we have received reports and confirmed reports of increase in the number of GBV cases that are reported during this period that since the COVID pandemic hit. And also the other impact was the quality of care that was being provided to children in childcare facilities. And also the issue of economic hardships that families were experiencing that were putting children at a higher risk of separation, either to go into care, formal care, institutional care particularly, as well as going on the streets to help supplement the household income. School closures put a lot of stress on the families, and as a result, we have seen an increase as well in the number of girls that are falling pregnant, and also child sexual exploitation and abuse, where we have an increase in the number of children being recruited into sexual exploitation. So they're being found in brothels. And online learning as well for Zambia was a challenge, even when schools were out, because not all families had access to internet facilities, let alone the gadgets that they would connect to internet for them to access the education materials that were available online. So in responding to some of these challenges, UNICEF supported government to develop a COVID emergency response plan, focusing on care and protection of children. And based on that plan, different stakeholders were brought on board, and the children in families partners that Clement mentioned, CMMB, Save the Children, Zambia Association of Sisterhoods, Catholic Relief Services, came on board, plus other civil society organizations and NGOs working in Zambia to support the implementation of that response plan. Particularly to note was the response to children in care, where personal protective equipment was provided for use in childcare facilities. And then government also issued a directive to reduce, for facilities that were able to reduce the numbers of children in care, to do so. And so for children who were already under preparation for reintegration, those ones, the processes followed and the reintegration was facilitated. But for some children, as Malawi reported, Zambia also had a situation where families were not ready, children were not ready, but because there was an indication that this child their parents live in this community, so those children also were discharged to go back to their families. So that was something that happened, and we kept a tab on it. So when there was an opportunity for government to respond to the economic hardships at family level, the UNICEF, working together with other UN agencies, mobilized resources for the COVID emergency cash transfers. So there was an opportunity there for government to broaden the criteria and categories of households that would benefit. And children in families was a group that we lobbied and were able to get a slot for families who had just received children reintegrated in a hurry or reintegrated following the process were included on that emergency cash transfer support, as well as families who had children who had remained in facilities but had other children because those children were identified as being at risk of separation, and also caregivers, the young people who had left institutional care due to COVID or because they had been prepared adequately to move, were also equally supported. So basically, those are some of the activities that we did. And to add on, government also was supported together with CMMB, Catholic Medical Missions Board, and Save the Children, together with UNICEF, supported government to develop case management referral protocols between Ministry of Health and Ministry of Community Development. So this was to ensure that children who are rendered at risk of being in need of care, either because their parent has died of COVID or because their parent has been admitted in a quarantine facility, are linked to the Department of Social Welfare for emergency care. In addition, UNICEF supported government to develop a guidance note for emergency care of children due to COVID. So this was a guide for district social welfare officers on what steps they needed to take to ensure that even during COVID, family-based care is prioritized over institutional care. Over institutional care. So to respond to the issue of gender-based violence and child sexual exploitation, a multi-sectoral GBV task force has been put in place, which is applying case management processes to support children and families who have been withdrawn from the brothels. And even the monitoring, so patrols are going on between Ministry of Community Development and the Zambia Police to just ensure that this vice is curbed. One last point was the introduction of community case management. So community case management has been very key during COVID, where government has continued, particularly anchoring it on the emergency families that received emergency cash transfer, because on that group we have families that were at risk in community, as well as families that received children from childcare facilities through the reintegration program, who are now receiving intensive family support and follow-ups and being linked to other services depending on the vulnerabilities that community volunteers identified, but still working very closely with the Department of Social Welfare in the respective districts. Over, Mona. Thank you.
Thank you so much, Mwamsa, for again highlighting some of the challenges Zambia faced at the onset of the pandemic, and also the various initiatives that UNICEF working, with government to advance the care of children in times of the pandemic. One thing that I'm picking up from your interventions, is that we need to the emergency preparedness. How well are our programs? How resilient are our programs? So that when an emergency comes in, whether it's a pandemic or any other crisis, so that our programs are supposed to be able to continue. So thank you very much for that. In the interest of time, I will move, I'll go straight to the last question, question number 5. And this question is to Jeremiah Banda of Zambia Association of Sisterhoods. So Jeremiah, here is your question. In Zambia, the Catholic Church has played a key role in the care reform. What difference do you think this has made to care reform efforts? Over to you, Banda, in summary.
Thank you very much, Mona. So to begin with, in Zambia, we have what we call the Catholic affiliated residential childcare facilities that are 46, and that is around 29% of all the childcare facilities in the country. And so we started the project called Catholic Care for Children in Zambia, funded by GHR. And of course, as others have spoken, we have a good number of partners, 5 or 6 partners of us that are funded by GHR and doing similar work in our different constituencies. But for the Catholic Care for Children project in Zambia, it's like it's a national coordinating body for all Catholic affiliated childcare facilities, those run by the dioceses and also those run by the sisters and the brothers. So in terms of what the national childcare reforms have done, we at the ZAS Secretariat, we are going around all the childcare facilities to build capacity of facility workers, but also to engage the clergy and the religious to understand that even if our core for taking care of children is through our charisms, we need to be in tune with what is happening now. We need to respond to the national childcare reforms. And so through congregations having their chapters, they are also reviewing their charism and to see the possibility of changing the model of care, maintaining their charism, but being able to start taking care of their children from their families and from their home. So we are trying to change the model of care to a home kind of approach. Now, one beautiful thing that I want to share with you, Mona, and the rest is that through GHR, now we are working with the 5 other countries that are also implementing like care reforms. So we are working with Kenya, Uganda, Malawi, now Zambia. And so we have made up like a movement to influence the superiors to change their mindset in terms of, instead of caring for children in institutional care, to start reflecting and changing the model of care. And also we have gone as far as also up at the international level, what we call Union of Superior Generals in the Vatican, right there where decisions are made also, we have a platform where also the major superiors there are talking to their fellow major superiors to think through and join the movement of changing the way we care. And so this has helped slowly. We are changing the mindset. The clergy, the bishops are starting buying into it. And Pope Francis just announced also how really we should think of raising children in a family environment, as the family is the best place to nurture a child's growth. So I think this is our contribution. It's not an easy task, but it is a movement that we are seeing that slowly it will yield very positive result, because I think we are beginning to speak one language, that of changing our model of care. Thank you.
Thank you. Thank you very much, Jeremiah Banda, for sharing with us the efforts of the Catholic Church in Zambia to advance the care of children in family-based setting. And in this region overall, you know, religious leaders have a great influential role in advocating for positive change. So we're very pleased to hear that, you know, at the highest level of the Catholic Church, the mode of family-based care is being discussed and is being rolled out to ensure that the mindsets are changed and families take on board children. Let me now stop there, Emily. Okay, maybe we have a bit of time to go back to question 4. This is what I know. So let us go to question 4. This question again is for Mr. Enoch Bonongwe and of Malawi and Mr. Clement Chibuta. So here's the question. In both countries, efforts have been made to support foster care. Can you tell us about some of the key challenges relating to foster care and how you have responded to these challenges? So let's start with you, Mr. Bonongwe of Malawi.
Okay, thank you, Mona. As regards foster care, of course, there are challenges, and but for us, we think that foster care is the only system that if enhanced and if we improve the foster care system, then it is a solution to having a lot of children going into institutional care. But in Malawi, the foster care system, yes, is facing a lot of challenges. Firstly, using our integration program, we were able to develop the foster care training manual. But this manual has not been finalized and localized, validated, and for use in Malawi. We have also seen that within the foster care, we do not have a lot of people coming in as foster parents. And what we are looking forward to is to have parents that can come in a form of emergency care, those that can take in children with the special needs, and also those that can take in children for purposes of adoption. We have just noted that at the moment, those that are taking in children for foster care are those that would want to adopt at the end of the day. So this then presents a challenge in such a way that for children that would have gone for foster care on an emergency mode, and after 3-4 weeks they're out of that care, we don't have that. We don't have incentives for parents that would want to take in children. We used to have foster care allowances, and I think in some countries we also have a situation where those that take in children are supported by government for the extra burden that we don't have in Malawi. There is also another school of thought that if we give parents money for taking in children, then there will be some parents that will go in it just for the money. But we know that there are parents that have a goodwill to take care of children, but they don't have the means. I think these are the ones that we can help if we have the incentive to do that. We have also seen that our gatekeeping mechanisms for preventing children to go into institutional care are falling apart. The community cohesion to take care of the children is not there, and if it was there, then the children would have gone into either in the care of siblings, extended family, community member, the foster and foster care, or even adoption. So we still have challenges related to foster care in that regard. All in all, we just want to have our foster care improved in such a way that children that are in need of care not go into institutional care, but would be taken care of by a vibrant foster care system with the classified, registered foster parents that are well trained. They have capacity. they have the motivation they need. We would want to also make sure that communities are involved in the process of foster care, and we bring awareness on the alternative care options, of which foster care is one. Thank you.
Thank you very much, Mr. Bonongwe, for highlighting the foster care system in Malawi. Let us now, but before we go to Clement, I would like to remind dear participants to please type in your questions or comments that you have based on the various, questions that the panelists have responded. Please type in any question you have, and we'll ensure to address it in the next session, which is the Q&A. And now to you, Clement, kindly respond to this question again in a very summarized way about one highlight of what is happening in Zambia in terms of the challenges. Over to you, Clement.
Yeah, and of course there are a lot of challenges surrounding foster care. One thing to just mention quickly is that there is a provision in our legal framework about foster care and boarding out children to a fit person, either be it an institution or indeed an individual. So the surrounding issues of course maybe foster care not being popular, maybe not being a common practice, and then also maybe not having foster care be publicized enough, for people to get to know that this is a service that the government is offering. We also note, the weakness of the extended family. It's breakdown, and as such, in our efforts to try and promote foster care, we look at also strengthening the issues of kinship care. So in summary, let me just give you some of the things that the government is doing in responding to the challenges around foster care. So the government has developed foster care guidelines, so trying to help officers, case managers, in a step-by-step process on how to, ensure that children are provided this service. And then we have the continuum of care. I think I alluded to this earlier, where we emphasize on keeping the family together, preventing family separation as being the first core. And then secondly, we look at the alternative care options. And as I mentioned, supporting kinship care, trying to make sure that it is strengthened as something that we can rely upon to be able to provide the foster care service. We're also looking at the communication and advocacy strategy that was developed as one of the key aspects to try and promote family-based care, and key to it is foster care. Like Malawi, the issues of incentives also maybe for prospective foster parents are an issue that, of course, is one challenging issue that Zambia is also grappling with. I think the last time incentives were given was around the year 2012. So you see that we also have a challenge in that regard. But I want to mention also that the government, working together with an organization called Alliance for Children Everywhere, is embarking on emergency foster care projects that will ensure that there is a pool of prospective foster parents who will be readily available to offer a kind of emergency foster care to children that are in need of care. So this is the whole context in which we are responding to issues of challenges of foster care in Zambia. So in summary, I think that would suffice for now. Thank you, Mara.
Thank you. Thank you so much, Clement, for sharing with us, the foster care system in Zambia and also Malawi. And now let us now move to the Q&A session. I'd like Emily to take us through that. Over to you, Emily.
Thanks so much, Mona. So far, We just have one question that's come up in the chat box, I think, unless I've missed something. And that question was, is the case management training available online? I'm not sure which country this referred to, as I know you've both done some training around sort of workforce strengthening and case management. But maybe you can let us know if any of your training programs are available online that you've done with the workforce. Maybe I'll ask our colleagues from UNICEF that question, Miriam and Mwanza. Hi, Mwanza, why don't you go ahead?
Okay, thank you. For Zambia, the training is not yet online, but discussions are in progress right now between the Ministry of Community Development and the academia. Given that the development of the short courses also inform the development of some main courses under the postgraduate and the undergraduate programs in the social work division in the two universities. So we are hoping that beginning 2022, we will have the first cohort of participants on the online training in alternative care and case management, as well as protection of vulnerable migrants and child justice. Over.
Thanks so much. And Miriam, do you have any of your training programs available online or any other resources that people might be able to refer to?
Maybe Emily, is it not possible that I refer to Enoch because
of course
the government? So maybe let him respond. But we have the tools available and electronically, and we can share to all countries that may need it. But let Enoch respond. Thank you.
Thank you. Please go ahead, Enoch.
Yeah, for purposes of online training, the trainings per se that we have not commenced in Malawi online trainings. I think this is something that we can work with UNICEF to see in light of COVID, how we can have online trainings. But the materials are available on UNICEF website, or our training manuals, the tools and everything, they are available for other countries to use. But since the trainings require that maybe people go through the modules, they go through the exercise, they go through these other things, it has to be a facilitated kind of process where I would say enroll and train and get trained online. So that we have not started as a country. Thank you.
Okay, so there's another question for you, Enoch, I think, which is well from just wanting to know from the Malawi team if they have the reintegration package and if they can share what's involved in that package. So I know that package is available online because I've looked at it and it's really interesting and a really valuable resource. But do you want to share a little bit more about the resources that you have available on reintegration from Malawi?
Yeah, I think as a country we have online resources for reintegration for purposes of referencing. The first of it is the reintegration study done in 2014. After that, we have 2017 thereabout. We have got the reintegration training manuals and the tools. Around 2018, we had the feasibility study. And we also have the reintegration model there. And I think we also have some best practices for children that have been reintegrated and are doing well in the community. So we have, I think, literature towards that. Thank you.
Thanks, Enoch. And just to flag that all of those resources are included as links in the virtual study tour document that I shared ahead of time. And if you haven't got that, if you look at the link in the chat box, you'll be able to find that document and all of the other virtual study tours and the other resources that are coming out of this platform if you follow that link. So we have a question now for Zambia, which I think I might ask Jeremiah to answer. Was there any initial resistance from the Catholic affiliated organisations to the care reform process, or was that very smooth? Were they willing to make those changes immediately?
Okay, thank you very much. I think in the beginning, yes, we had a lot of resistance because the sisters are passionate to take care of the children. Now, what used to happen if a child is reintegrated and maybe 3 or 4 months later, you go and do your post-placement visits, we're seeing that the children's lifestyle, care, and so on has deteriorated. And that really made the sisters not to buy in this process of reintegration. But now, because of the funding from JSHARA, we are also starting with the family strengthening activities before placing back a child into a family environment. And so we are seeing these families having ability to care for their children and even to provide basic necessities. And that has also now stimulated the mindset of the sisters that with some economic strengthening at family level and using a family approach system where you strengthen the entire family so that they are able to take part into whatever interventions at family level that can help them to improve their well-being. So that is the direction that we are really now going. Although we are saying it's not easy, but also one area that has helped us is that within the conference of the Catholic bishops in Zambia, we have a commission that is looking at the welfare of the children. And so we sit in that commission and be able to inform the bishop with regard to how best family-based care is, and also issues to do with national care reforms. So the bishop are also taking the messages to all the superiors and the priests and the clergy, and slowly we can say we are really penetrating with also at the Vatican level, Sister Party and others that are also speaking the same language from top to bottom and also from bottom to top. So we are intertwined, and we're in between discussing the need for us to support family-based care options and institutionalization. So that's where we are as Zambia.
Fantastic, thank you. That's so fascinating, and it's so great to see that change happening at the top and working up from the bottom, as you say. That's really wonderful to hear. So a final question, I think, unless anybody else wants to type in any last questions, and this goes first of all to Clement around why, if there's any reason why the incentives for foster families that were previously provided were stopped. So Clement, did you want to take that question?
Yeah, I think basically it's just a question of the financial stress or financial inadequacy, from the point of view of the government. But however, that said, we want to mention that with the care reforms that are happening right now, we would like to see a situation where once we have a pool of prospective foster parents in place, we like to devise a system where there could be some kind of support or incentive to these families. I think speaking with our collaborating partners and other NGOs as well as the government itself, I think we have political will at that point to try and ensure that children's interests are advanced and children are protected. Thank you, Emily.
Thank you. And Enoch, did you have anything you wanted to add on that from the perspective of Malawi?
Yeah, I think similarly, similar to Zambia, the issue has been financial constraints. But I think on the Malawian side, there was a time we were shifting from these support, like those that are coming from prison, students, and even the foster care grant. they were cut off, and we introduced the social cash transfer. So these were like remittances to the same vulnerable people, but in another way. What we saw was that our voice was not that strong to advocate for those that are released in prison, for the students, for even the foster care, for foster parents to be getting these grants. These were pulled into the social cash transfer, which in some way does not come back to the child when because not all poor parents that are taking care of the child are on the social cash transfer. It has a different targeting criteria and so on. But I think that's what we also saw, because it was around the same time these monies were drawn when we were starting on the social cash transfer. So I think the government just diverted the money up and put it the other way around, but it did not get back to the people that we were supporting. Thank you.
Thank you so much. And that's links very nicely to, just to let you all know that we have 2 forthcoming publications, one on foster care, which touches on this issue of whether you pay foster carers and how you properly support foster carers, because that is quite a big issue that's come across the whole region. And the other publication is on social protection and care, which Enoch was discussing a little bit in terms of how you target social protection programs patched to better support caregivers such as foster carers. So please look out for those. I've provided a link to the Child Frontiers website where you can find them, and they'll also shortly be available on the UNICEF website for the region. And with that, I'll hand over to Mona, who can just wrap up the webinar, and we'll finish up. Thanks everyone for your answers and your excellent questions.
Thank you, Emily. I just want to extend my appreciation to the esteemed panelists from Zambia. We had Clement Chibuta of the Department of Social Welfare. We had Mwansa Chilufya Malupande of the UNICEF Child Protection Section, Jeremiah Banda of Zambia Association of Sisterhood. And for the Malawi, we had Mr. Enoch Bonongwe of the government of Malawi, Miriam Kalua of UNICEF office, and Trofina Limbani from the government of Malawi. So I'd like to thank you very much for very insightful comments that responses of your program. And as Emily mentioned, we will be sharing the different publications that have been developed under this learning platform. Child Frontiers has already put the publications on their website. We will also be doing that for the UNICEF SRO website soon, which is available to all the public. And also want to thank Emily for facilitating this session and for all the work that you have put in to ensure that the learning platform is running smoothly. So thank you so much for that, Emily. And of course, to our dear participants, thank you for connecting with us. Even though this is the most busiest time of the year, this really shows the interest of learning more when it comes to care reform initiatives and programs in our respective countries in the region. I also want to announce that we have come to the end of phase 1 of the learning platform on care. We'll be sharing more details on the new phase 2, in 2022 in January. I also want to let you know that we'll begin with the webinar on child protection system strengthening and care, which will start in January. So more details will be shared with you soon. And again, just to emphasize that the various documentations that have been made available for us, we will be sharing those with you. And please ensure that you share them with your partners who are also working in the area of care reform. And lastly, just to say that we will be at the regional level. Our plan is to extend the contract with Child Frontiers so that we can have a smooth continuation into phase 2. And once all that is ready and available, we will be providing that information and the various topics that will be covered in phase 2 of the learning platform. So with that, I want to wish you all a very happy holidays that are coming up. It's the holiday season soon, already started. Today is the 1st of December. And also for those that I will not be able to interact with you in the near future, I want to wish you a very joyous new year. So with that, I thank you all. The webinar recording will be shared and the various links to the available documentation will be shared by email. With that, I thank you and I wish you a very good rest of the day. Goodbye for now.